With this lecture, I am going to continue what we have started yesterday regarding viral infections of the skin and mucous membrane. Today, we will speak about herpes viruses, which belongs to herpes viridi. Once you see viridi, it means family. So herpes family. These are large double-stranded DNA viruses, enveloped viruses, have enveloped viruses, and they are of 8 human types. I would like you to know exactly the 8 types. Herpes simplex virus, HSV, herpes simplex virus, type 1 and type 2 can infect facial areas and genital areas. And we will go into details in a moment. Varicella zoster virus, which is chickenpox, which is the varicella. Zoster is the shingles. الجدري المائي ولاحقا الحزام الناري shingles. Epstein-Barr virus, EB virus, which can cause mainly infectious mononucleosis, IMN, and Burkitt lymphoma, associated with Burkitt lymphoma. Cytomegalovirus, CMV, mainly can cause blindness, in particular in HIV-infected patients, AIDS patients. Human herpes virus type 6 and 7 are associated with a disease called rhiziola, and we will talk about its we have talked yesterday about rhiziola infantum. Human herpes virus 8, type 8, with Kaposi sarcoma. So Kaposi sarcoma related to herpes virus type 8. This is the summary of what we are going to go into details in a moment. Herpes viruses are having icosahedral capsid متعددة الجوانب, tegument, غلاف, and lipid envelope. You will see it in a picture in a moment. You can see it here. This is the nucleocapsid. This is the tegument, معناتها غلاف, and then the envelope. And there are spikes also attached from the envelope, arise from the envelope, spikes for attachment of the virus. These viruses can cause lytic changes in epithelial cells when infected, lysis of epithelial cells. And these viruses also have characteristics of latency in neural cells. From the epithelial cells, they go to neural cells. What is the meaning of latency? They are going to go there and sleep. تدخل في طور سبات in neural cells, no replication. But the genome of the virus is still present in the neural cell. When the immunity is depressed, or there will be a disease that causes low immunity, this latent virus becomes reactivated. تكتسب الحيوية مرة ثانية, and then can cause infection of this immunocompromised host. So remember, these viruses have the capacity of latency. This table is very important, of 2 pages, human herpes viruses. We are going to talk about designation tesmia, and then common name for it, the route of transmission, the primary infection, the disease they cause, and the latent infection, the latency, where they are going to stay. Let us start by a human herpes virus type 1. They are called herpes simplex virus type 1, HSV type 1. They are transmitted by close contact. They infect mucoepithelial cells of the mucous membrane and epithelial cells. What they cause? They cause oral fever blister. من واحد يصير عنده حرارة تطلع زي الحبيبات قريبة من الفم أو داخل الفم بالmucous membranes. They infect the eye also, very dangerous in the eye, ocular lesion, and they may cause encephalitis. The latency in the nerve ganglia, we said in neural cells. Type 2, called herpes simplex type 2, again close contact, but look here, sexual transmission. It means this type of virus type 2, it can cause sexually transmitted diseases. And we will talk in details in a moment about it. Again, mucoepithelial cells can cause genital lesions, anal lesion, severe neonatal infection, and meningitis. Here, first, the first type, encephalitis. Now we have said meningitis. Where they are going to stay? Nerve ganglia. Type 3, a human herpes virus type, varicella zoster. Varicella zoster. We said the varicella, it means the chicken pox. And the zoster is the shingle. So this virus can be transmitted through respiratory route, inhalation, close contact, again mucoepithelial cells, can cause chicken pox, the primary infection بالأطفال خاصة. chicken pox الجدري المائي. وفي تسميات بالعامية لهالمرض هذا تختلف من مكان إلى مكان آخر. And then it will stay latent in the nerve ganglia. If the immune system suppressed, the patient will have shingles, which is the zoster. الحزام الناري. وراح نشوف pictures for it in a moment. HHV4 EB virus, Epstein-Barr virus, can be transmitted by saliva and kissing. Primary infection B cells, B lymphocyte, and oral epithelial cells. As I said, can cause infectious mononucleosis. Infectious mononucleosis is primarily B cell infection, B lymphocyte, maybe causing a tumor, including B cell tumor, Burkitt lymphoma, immunoblastoma, mainly in immunosuppressed patients, and nasopharyngeal carcinoma, and sometimes T cell tumors. Where they are going to stay latent? In the B lymphocyte. Remember, this virus can be associated with different types of malignancy: Burkitt lymphoma, immunoblastoma, nasopharyngeal carcinoma, and some T cell tumor. Remember these 4 types of tumors. HHV5, cytomegalovirus, close contact, sexual transmission, congenital, blood to blood, transmitted via blood transfusion, can be transmitted by transplant. That is why transplanted patient, before taking the tissue from the donor, should be checked for CMV. This virus could infect leukocyte, T and B lymphocytes, monocytes. These viruses can cause mononucleosis-like infection, but not the infectious mononucleosis. It is like it. similar to it. Severe congenital infection, if it occurs during a pregnancy. Infection in immunocompromised patient can lead to gastroenteritis, can lead to retinitis, which I have mentioned in a moment in HIV and in AIDS patient, can cause retinitis, which leads to blindness, العمى. مرضى الايدز بالنهايه من تقل عندهم خلايا التي سيلز يصابون بالعمى due to CMV infection, and also can cause pneumonia in immunocompromised patients. The latency of this virus in the monocyte, in the neutrophils, in the vascular endothelial cells also can stay latent. Herpes 6 and 7, 6 human herpes 6, close contact respiratory route, primarily infect T cells, can cause rhizola infantum. Also can cause infection in allograft recipient. In a transplantation can cause pneumonia and bone marrow failure. Latency, T lymphocyte, monocyte, macrophages. Again, 7, also associated with rhizola. Can be transmitted by saliva and close contact and stay in T lymphocytes similar to 6, where they are going to stay their latency in CD4 positive T cells. The last one, human herpes virus 8, Kaposi sarcoma, associated with this infection, can be transmitted by saliva and blood. They infect primarily B cells, peripheral mononuclear cells, oral epithelial cells, can be associated with Kaposi sarcoma and some of the B cells lymphoma. Where they are going to stay in their latency, B lymphocyte, virus infected tumor cells. I would like you to know the number of the viruses and its name, its type of infection. Very important. These viruses are commonly present and commonly you are going to face them in your clinical practice, inshallah, in the future. We mentioned this structure. Let us start by talking about these viruses one by one. Herpes simplex type 1 and type 2 are quietly related genomically from gene point of view. How we differentiate between them? We can differentiate between them by PCR, also by specific antibody test. Antibody against each one, a specific one. Herpes simplex type 1, highly prevalent, very commonly present in the community, and you will see. Herpes 2 is sexually transmitted, and we said that. At the site of infection, there will be inflammation, there will be giant cells for phagocytosis to engulf the virus, and then their latency in the neurons, latency sensory ganglia. They are called in the sensory ganglia episomes. Reactivation occur, as I said, when the immune system suppressed. Also can be reactivated through excessive sun exposure. Some people who are not tolerant to the sun exposure may get it. Fever, trauma, stress. طلاب تشوف ايام الامتحانات يصير عندهم هذا البلستر الهيربس سيمبلكس وراح تشوفوا البيكتشر وتقولوا صحيح هذا الكلام. These are the multinucleated giant cells to phagocyte the virus particles. This is EM picture. Clinical capsule, herpes simplex are herpes viruses, very well known. They are quite common. They can cause infection in the community. They can cause recurrent vesicles and ulcers of the skin and mucous membrane. Remember, skin and the mucous membrane. They are quite prevalent among immunocompromised patients and can cause encephalitis in normal hosts. The infection acquired by infants soon after delivery. Most people are positive for these types of viruses. Herpes simplex type 1, they say its infection is above the waist, فوق الخاصرة، يعني بالقسم الأعلى من الجسم. Herpes simplex, because it is sexually transmitted, it is below the waist. During latency, when the virus become reactivated, they lead to viral excretion or disease. Immunity limits the spread. ADCC, you remember, antibody-dependent cell-mediated cytotoxicity, for example, through the NK cells. T-cytotoxic T cytotoxic, destroy the herpes-infected cells. And these viruses also have inhibitors of the immunity, can inhibit the immunity. So this is broad lines, just tips about the immunity against these viruses. The clinical manifestations, herpes simplex type 1, above the waist, can cause facial infection in the face mainly. And also, these type 1 start to cause genital lesions increasingly. يعني بدينا نشوف احنا التايب 2 هو الجينيتال، بس type 1 ممكن possibly can cause genital lesions. The lesions either grouped مجموعة من lesions or can be single vesicular lesion. These lesions may become pustular. What is pustular? It means vesicle containing pus. Lesion بها pus. Then this pustular lesion will ulcerate, become ulcer. They cause infection of the skin, as I said, mouth, conjunctiva, very dangerous when they infect the eye. I have seen many patients have conjunctival infection by herpes simplex type 1. Nervous system, as we said. Primary infection can be asymptomatic, generally speaking. In children, they may cause gingivostomatitis, that is to say, lesions in the mouth, on the tongue, gums, and pharynx. Latency, they are going to stay in neural ganglia. Here, for type 1, trigeminal ganglia. And you know from neuroanatomy what is a trigeminal ganglia. Cold sores, الحبيبات اللي تظهر مع الرشح, mucocutaneous, epithelial, usually unilateral. Remember, unilateral في جهة واحدة، لأنه راح نجي على التايب 2 herpes simplex نشوف sexual lesions bilateral. Reactivation, and the virus can stay in the saliva in the people between 5% and 8%, 10% carriers of the virus. Look to these blisters. This is herpes simplex type 1. I'm sure every one of you had such a lesion. In stress, in fever, in different categories. When the immune system is suppressed, these viruses will be reactivated. This is herpes simplex type 1. Herpes simplex type 2, genital infection mainly, but usually not frank, not overt. يعني مو ذاك الفيروس اللي يخلق لنا مشاكل كبيرة. And their characteristic, they reoccur quite frequently. يعني ينعاد يصير به reactivation more than herpes simplex type 1. يعني الريكورنس بالتايب 2 أكثر بكثير من التايب 1. An incubation period about 5 days. There will be papule. Papule يعني بثرة. Vesicle, when the papule contains a fluid, it is called vesicle. And the vesicle, when the fluid change to pus, it is called pustule. You will have these terms إن شاء الله سنة 5 من تاخذوا dermatology. These ulcers are usually painful and multiple, around 20 ulcers, bilateral at the genital area and extensive. Urethra and cervix may be infected and may be associated with tender inguinal lymphadenopathy. Tender يعني مؤلمة. Lymph nodes will be increased in size and painful. This type of infection may last for about 12 days and then disappear for a while and then reoccur again. This is genital herpes infection. You can see the lesions which I have described them. Vesicles and pustular ulcers. Recurrent genital herpes, usually the recurrence, when it occurs, it has shorter course. مدته أقل. حكينا بالبرايمري 12 يوم. يمكن هون أيام قليلة. Localized. It is associated with prodromal paresthesia. يعني كأنما المريض يحس بخدر بالمنطقة 12 to 24 hours before the lesions appear. حتى المرضى يعرف أنه راح يصير عنده recurrence because of this paresthesia. Paresthesia معناتها خدر. They comes in groups and stay about 2 to 5 days with mild pain. Recurrence is common, we said. Reactivation from the dorsal root ganglia. Right? We said herpes simplex type 1 from trigeminal ganglia. Diagnosis, cell culture. This is done for research work, for epidemiological, not for routine work. We can detect herpes simplex type 1 and type 2 and differentiate between them by type-specific antibody, as I said, and by PCR also. Treatment, a drug called acyclovir, mainly for the primary lesion, less on recurrent. Valcyclovir, نفس هذا الأسايكلوفير, but more effective, is called valcyclovir, famciclovir, and penciclovir for recurrent genital ulcers. These drugs are very common and you should know them. Varicella zoster. We said varicella is the chicken pox and the zoster is the chicken. Have the same structure because the same virus. الطفل يصاب بالفاريسيلا وكبار السن عادة من تنخفض المناعة يعاد المرض على شكل زوستر. This type of virus is the smaller virus among herpes viruses. Difficult to culture, so we don't use culture for these viruses. It is the most infectious herpes virus. Is the smaller virus among the herpes, and it is the most infectious. Cell-mediated immunity control varicella zoster infection and reactivation. So if the cell-mediated immunity is suppressed, of course, varicella zoster virus will be reactivated. Circulating antibodies, yes, circulating antibody can prevent reactivation. Varicella zoster, as I said, chickenpox is varicella. Shingles is the zoster. Chickenpox, it occurs in children and then stay latent virus, especially will become reactivated in elderly people when the immune system become weaker. The virus remains latent in the neural ganglia, reactivated as the cell-mediated immunity decreases. Almost 90% of children by the age of 10 years in United States become infected with this virus. And the virus spread primarily via respiratory secretion. A primary and reactivation are both common in immunocompromised individuals. Logical, because the immune system can control them. Once the immune system weakens, these viruses become reactivated. Pathogenesis of chicken and shingles, varicella zoster, family herpes viridi. It is the human herpes virus type 3, as we said. Double-stranded envelope, reservoir only in a human being. So this is the virus, looks like that, double-stranded, nucleocapsid, tegament, lipid envelope, and the spikes for attachment, the glycoproteins. Chickenpox, varicella. It is caused by varicella zoster virus. It's sudden, acute infection, generalized, itchy rash, طفح جلدي بحكة, with fever, vesicles in the mucous membrane. Smallpox, remember, smallpox infection, which we have spoken about, it has no lesion in the mucous membrane. Chickenpox has lesions in the mucous membrane. This is one of the differentials between the two diseases. It is usually mild disease, self-limiting. يعني الطفل ينصاب وتمشي الأمور، ولو في الآن لقاح راح نتكلم عليه. مطعوم. There will be severe fetal damage when occurs during a pregnancy. لهذا السبب we should vaccinate our children in order to prevent such complications in the future. What are the complications? Pneumonia, secondary bacterial infection, hemorrhagic complication, encephalitis, Reye's syndrome, very important. Child will have fever, and some people, they don't know and give aspirin. Also, liver damage may be caused if aspirin is given below 16 years of age. So there will be brain damage as part of the Reye's syndrome and also liver damage. This is the chickenpox. The lesion widely spread, itchy, start at the back of the head. حتى الأمهات يعرفوا بالدار أنه أول إشي الليجن يطلع at the back of the head and ears, خلف الأذنين, and then to the face, neck, trunk, and the proximal extremities. Mucous membranes also involved, as I said. This is the chickenpox. Shingles, هذا هو الحزام الناري. أكيد قسم منكم شايفة بكبار السن أو شخص من تضعف مناعته. Reactivation of the varicella, يعني chickenpox تبع الطفولة in immunocompromised now can cause shingles. هذا هو الشنجل. Zoster. Inflammation of the sensory ganglia of cutaneous sensory nerves. Very painful, very painful. I have seen patients cry from the pain. Fluid-filled blisters, pain, paresthesia, numbness, and tingling, commonly after the age of 50 years, when the immune system becomes weaker and weaker. You can see the shingles, fluid-filled blisters, very painful. Transmission person to person, direct, droplet, airborne, vesical fluid secretion of respiratory tract in chickenpox. Diagnosis clinical. أي طبيب يقدر يشخصها. طبيب الجلدية بنظرة واحدة يشخصها. And also, epidemiologically, you can have many cases at the same time. Also, immunodiagnosis by ELISA to detect for antibodies specific to the virus. PCR also, molecular, cell culture, EM, electron microscopy. Treatment in immunocompromised acyclovir. In immunocompetent اللي مناعته كويسة, acyclovir, which has moderate effect on post-herpetic neuralgia, if you started within the first 3 days, it will be very effective. And it is less susceptible than herpes simplex virus for acyclovir. Famciclovir, valciclovir are better. Also, you can give strong analgesia for the pain, calamine, just to decrease the itching, and the steroids sometimes we give just to decrease the inflammation. Prevention, passive antibody immunization, if you give it in the first 4 days, within 96 hours. After that, it will not be effective against both varicella and zoster. It is not for the reactivation of the virus. There is live attenuated vaccine, live vaccine, which is safe and effective, can be given in a single dose around the age of 1 year, 12 months, up to 15 months. And then you can give another booster dose at the age of 4 to 6. It can be given with MMR. I said MMRV, if you remember yesterday. Measles, mumps, rubella, and varicella. Adult vaccine can be given for patients or individuals above 60 years of age, just for prevention of occurrence of this painful disease.
دكتور
بس خلي أخلص آخر سلايد واسأليني.
ماشي.
Okay. Now the properties of attenuated varicella vaccine, هذا اللي تكلمت عليه, الvaricella vaccine, rarely can cause rash, in about 5% only. 2 doses recommended, can induce cell-mediated immunity. Lack of contact infection in most cases. They decrease this virus, this vaccine can decrease the infection, of course, and decrease the transmission of the virus. Induce long-term protective immunity. Prevent disease when administered within 3 days after exposure. Incidence of herpes zoster among children who have leukemia is lower than those who are not vaccinated. More than 90% of protection for the household of healthy children. يعني this vaccine, if you give it to one member, the protection may be transmitted through shedding of the virus, and the vaccine will be transmitted to other and gets protection. Okay? Any question?
دكتور أنت حكيت إنه بالباسيف أنتي بودي immunization ما بنعطيه for reactivation.
نعم.
كيف يعني ما بنعطيه for shingles يعني مثلا؟
الرياكتيفيشن يكون عنده already antibodies، بس المناعة تبعته خاصة السيل ميدياتد immunity is weakened، ولهذا السبب يصير عنده reactivation.
تمام.
واضح؟
Yes, yes. Thank you.
Any other question? Okay. Stay connected. We will have a break for a few minutes, 2-3 minutes, okay? You can have a break for 3 minutes, and then we will start our new lecture.